Welcome to another edition of DermTube Daily Coverage at Maui Derm. With us today is Dr. Dee Anna Glaser, who's the Vice Chairman of Dermatology at St. Louis University, and she has been discussing here newer innovations in our use of fillers. Dee Anna, thanks for joining us.
Thanks.
Can you tell us about your presentation here?
Well, what I tried to cover is just some things that I thought the audience would be interested in terms of what's new, what to look forward to. And of course, the two big things that have hit the U.S. markets this year are Voluma, really designed for mid-face volume enhancement, and that's really added so much to our practices. And then, of course, the newest one is the Restylane Silk, which is a very fine product designed for the lips and the perioral lines, and really, I think, also adds another tool to our tool chest in terms of offering patients the best results that we can give them.
Do you have any specific tips in terms of how to utilize these products? Our patients come in and oftentimes have a lot of misperceptions about one product versus another. How do you really pare it down for patients?
Well, I think the point that you make is right, because you can get good results really with a lot of these products, and it's really more about the technique in terms of how it's being injected and how it's being used than the actual product itself, right? We've been injecting lips for a long time prior to Restylane Silk. I still think it adds something that we can offer to the patients, and the same with mid-face volume enhancement. I think the key is to really understand what the patient needs, to give the patient realistic expectations, and then to really fine-tune the injection technique so that you're giving it in the smallest amounts possible to achieve a very natural and harmonious result.
In terms of downtime, how do you really prepare your patients for the procedures that you do? We know you do a lot of laser resurfacing and liposuction. Do you meet with everybody ahead of time and review expectations?
Yeah, I think the consultation probably is the single most important thing that we can do for our patients, and really spend that extra time, not only in terms of what can be expected in terms of the outcome, but when it might need to be redone or touched up, and then how to avoid some of the complications on the patient side. So, right, avoiding things as simple as non-steroidal anti-inflammatories, taking out some of those supplements that they might be using for their heart, having them prepare not to exercise maybe for a day or two. When you really take that time ahead of time, it really makes the procedure go that much better and the post-operative time frame go better.
Dee Anna, we all come to understand that we have our preferences in different regions, and sometimes we have an order of the way we like to do things. Can you talk to us about your approach in an area like cheek augmentation or temple augmentation?
Yeah, so it's true. We each have our own preference, but I do think there are some principles that can be followed maybe to give the best outcomes. And one of mine is to really focus on the cheek first rather than, say, the tear trough. So if I think the patient might need a little bit of facial mid-face enhancement and may need some tear trough enhancement, I'll always go with the mid-face first, because sometimes then you don't even need to treat the tear trough afterwards. And I know a lot of people will say, oh, you have to start laterally first and then sort of work your way around. And I think that's a good approach. But sometimes patients really have a nice lateral fullness, and what they really need is a little bit more of a medial enhancement. So I think the most important thing is to really evaluate what the patient needs and to deliver that result for that patient, rather than worrying too much about a specific formula. The other thing that I think is really important as we're dealing with some of these bulkier, bigger, more robust fillers is to pay attention to the details, right? Be sure the face is very clean, right? We're putting in something that's going to last for a year, 2 years maybe, or more. So make sure it's good and clean. Make sure that we're retracting on the syringe to make sure we're not into an artery or into a vessel. Know the anatomy as best as you can, even though there are variances from person to person, so that we're avoiding those critical vessels, not only in terms of bruising, but in terms of other more serious complications.
I agree with you. I think sequence is so important, and for the folks out there who really need cheek augmentation, it's very rare for me to augment a cheek without also doing something in the temple. I think they go hand in hand. Letting an area settle down before injecting an adjacent area like the infraorbital area, I think is very key, and really understanding the anatomy in those really sensitive areas like the infraorbital or temple, which are both off-label at this point. So how do you explain that to patients when you go through those types of consent issues?
So I actually now have added into my verbal consent to every patient is that there are cases of permanent blindness that have been reported. And it obviously is a conversation stopper for the patients. It's a very serious complication. But then we review how infrequent it really is, and that knowing the injector and having that experience and knowing the anatomy is really the crucial part of it to try to avoid any kind of minor or serious complication. But I think patients need to know all of the risks that are associated with the procedures that they're getting ready to sign up for.
You mentioned preparation of the skin, and in this day and age where we have longer, more durable fillers, it's so important. So can you tell us about your regimen for preparing the skin?
So I usually just use alcohol. I do it several times. The patient has to remove their makeup. We clean the face first with soap and water, then we really clean with alcohol. The staff does that once. I repeat it myself, but there are other regimens. You can use betadine, you can use chlorhexidine, you can use combinations. I think whatever works for you and your practice is important, but as long as it's really clean, because these fillers do last a long time, and we want to make sure that the skin is fully prepped.
These are great tips, and we appreciate you sharing them with us. And thank you all very much for joining us for DermTube Daily Coverage from Maui Derm.